This is Hayden Scott, EMS Program Manager, EMS University San Antonio. We're now going to go over Lesson 3.8, Documentation, review of PCR and PCR writing. PCRs can be your best defense or your worst nightmare. Um, they're your best defense against illegitimate legal claims. However, they're also your worst nightmare when documented inappropriately. You can be sued for poor treatment simply off your patient care report. Proper procedure and documentation is essential to your defense if you end up in court. The purpose of the patient care report is a medical record. It's also a legal document. Um, it protects you uh, in your treatments, and it's also justification as to why you treated the patient the way you did. It's used for billing, for quality improvement. It's also used for training and research. A good PCR is accurate. It's just the facts. Completely objective, not subjective. It's complete. Every line has to be filled in or accounted for, even if there's nothing to put in that one space. Even if there's nothing to put in that one space, put NA for not applicable. It needs to be legible, also free of extraneous information. It doesn't label the patients at all. Remember, in the court's eyes, a sloppy report is just as bad as sloppy care. It's the same thing. Tips and tricks to a good patient care report. Write the care report as soon as possible after the call. Don't be afraid to use more than one page. Be extra careful on checkbox documentation. It also increases the chance of a successful lawsuit against you. So even in your narrative, you need to document why you checked that box, yes or no. Remember, if you didn't write it, it didn't happen. Addendums to your patient care report should be made as soon as possible. They may be documented at another date as long as the EMT makes sure to date the addition with the current date and sign or initial it. Some special info you should include in your patient care report. Long scene time. Why? Why were you on scene for so long? Uh, were you staging prior to making scene? Um, did you have an obese patient that was hard to move? Um, did you have a long extrication time because your patient was trapped in the vehicle? Is there any other pertinent information that you can think about? When dealing with an intoxicated patient, it's important to ensure that your patient care report includes factual and objective statements. Again, no labeling. Patient refusals are an extremely high liability. You have to use the patient's own words to describe the refusal. Have family members sign as refusal witnesses, not your partner. If there are no family members available, use their friends, bystanders, and then when all else fails, just use other agencies. Police department, a different ambulance crew, fire crew, anybody else like that on scene. This greatly reduces the chance of successful litigation against you. You need to write out specific outcomes that you warned. In the case of a diabetic patient that refuses transport, if you don't get checked out and this happens again, you could possibly die from it. You know, stuff like that. But you also have to write that you told the patient this. Always patch. Remember, you are decreasing your liability when you do so. Refusals with medications on board. Once you provide a medication to a patient, if they feel they would like to refuse, let them know that it's possible that the medication may wear off. And when it does, they're going to be back to square one and they're going to call you right back. It is your responsibility to inform them of the risks and consequences of refusal. Remember, you can never write too much information, but you can always write too little. The average frame time for a lawsuit or court case is 3 to 4 years. Can you remember that far back? The documentation of all events surrounding your care is your best defense in the event that a patient threatens to sue you. This concludes Lesson 3.8 on documentation. If you have any questions, please forward them to your instructor.